Nursing care of eating disorders. Module 3, Bulimia Nervosa, Hidden Complications. Let's talk about what's really happening beneath the surface in bulimia nervosa. This is not just about eating behaviors. This is a cycle that creates real measurable physiological instability. Bulimia nervosa is defined by binge eating, followed by compensatory behaviors like vomiting, laxatives, or excessive exercise. What makes this dangerous is that many patients appear normal weight, so the severity is often missed. The critical issue you cannot miss: hypokalemia. This is where I want your attention. Hypokalemia is the most life-threatening complication. Low potassium can trigger fatal cardiac arrhythmias. Not eventually, not maybe. This is immediate risk. What's driving it? Loss of gastric acid through vomiting, chronic dehydration, hormonal compensation through aldosterone, which increases potassium loss. What should you be looking for? Muscle weakness, irregular heart rhythm, mental status changes, ECG changes, like prolonged QT. If you miss this, you miss the patient's biggest safety risk. Understanding the acid-base imbalance. Vomiting leads to metabolic alkalosis. Here's the logic. You lose hydrochloric acid. The body becomes alkalotic. The kidneys try to compensate, but in doing so, they worsen potassium loss. Now contrast that: laxative abuse, metabolic acidosis. You need to be able to differentiate these based on the patient's behavior. What you should see on assessment. You are not guessing. You are looking for patterns. Russell's sign: calluses on the knuckles from inducing vomiting. If you're not checking the hands, you're missing data. Dental erosion, acid exposure breaks down enamel, especially on the back of the front teeth. Teeth look worn, chipped, almost moth-eaten. Parotid gland enlargement. Chronic vomiting causes swelling of the salivary glands, often paired with elevated amylase. These are not subtle findings, but they are often overlooked when you're not intentionally assessing for them. Close-up: digital lab value, potassium 2.8 MEQL, highlighted red, low potassium, or cardiac risk. This is your anchor NCLEX moment. Your role? This is where nursing matters. You are not passive in this process. Post-meal monitoring is essential. Supervise for 60 to 90 minutes after meals. Limit bathroom access. Watch for behaviors, not just compliance. Stay present, not punitive. This is about interrupting the cycle, not controlling the patient. How you build the therapeutic relationship. If you approach this with judgment, you lose the patient. You need neutral, non-judgmental communication, clear education about what's happening physiologically, consistent monitoring without shame, collaboration with the team. This is long-term work. Trust is not optional here. Treatment direction. You need to know where this is going clinically. With adolescents, family-based therapy is first line. For adults, CBT and fluoxetine, approximately 60 milligrams. If there's no improvement in about 6 weeks, treatment needs to be adjusted. Labs you should be tracking. You are connecting behavior, physiology, labs, potassium, arrhythmia risk, sodium, fluid imbalance, chloride, vomiting losses, bicarbonate, alkalosis, amylase, parotid involvement, and ECG rhythm changes. If you're just noting labs without interpreting them, you're missing the clinical picture. Bottom line, bulimia nervosa can look stable on the outside. It is not. The priority is safety. Identify electrolyte imbalances early, monitor consistently, intervene before the body decompensates, and do all of this while maintaining a therapeutic approach that keeps the patient engaged. That balance is what defines strong psychiatric nursing practice. We've looked at restriction. We've looked at purging. We prioritize safety, early identification, and consistent monitoring. Now we move into a different pattern, one that is often misunderstood, minimized, or missed entirely. Binge eating disorder is not about lack of control. It's about function. For many patients, the binge serves a purpose: relief, numbing, escape. To understand the behavior, you have to understand what's driving it.